Hey guys, this is Deanne with Hope Point Myo. I have been doing a series on my daughter's headache or migraine journey, and her name is Kate. So if you want to look at previous ones, you can find those to see how we've progressed to where we are now. But I wanted to give an update on where we are. We have started myofunctional therapy. We have done 3 sessions, which means we're into our 5th week, because you do a session and then 2 weeks of the exercises and then another. So we're into our 3rd session and into our 5th week, and I'm doing it alongside her and gaining as well. But I just wanted to let you know how that's going and where we're at and how she's feeling. One of the things that she is saying is she does feel better. That is, it's subjective, but it's a big deal. But I will say this, she has altered lifestyle. She's moved to where she was previously when she was in college. She's still doing college, but she was able to do online classes because of the stress and the headache. They allowed her to do that. But also she has relocated. I'm sorry, my dog just loves to be in on these videos. Anyway, she has relocated in a place where she doesn't have as many responsibilities, and that's been a lot better for her and less stress. So that is a huge part of all the tension and everything, is when there is added stress in your life, it adds pain and tension here because everything just kind of tightens up. So that's been helpful. But we're hopeful too that, I guess, the myofunctional therapy and just retraining the muscles and learning to get the tongue to separate in its function from the rest of the muscles, then that can help everything function the way it's supposed to. But she does have a deviated septum. I don't know if I mentioned that in previous videos. Honestly, the ENT locally said she didn't have one, but she had the CBCT scan, which is a full 3D of her whole face and everything, and it was clear. He said she did have a deviated septum, and she has an MRI also from having concussions and stuff that shows that she has a deviated septum. So that can be a part of an airway issue. There's so many factors, and according to the, I think, American Orthodontic Association, the any kind of airway issue starts just basically here in these holes and areas and goes all the way down to the hyoid. And so for her, she does have a deviated septum. So one thing that I've learned and that I've had her to start doing is wearing a nose strip right here. I haven't known much about those. I've seen people who do them, and actually I had my son doing them too, and he's seen a huge difference. But he was watching a football game the other night, and he's like, hey, the guys are wearing the nasal strips. I'm like, yeah, they just open up that nose airway and allows more oxygen in. But my daughter said that has really helped her. She's noticed a difference just wearing those at night. She was doing a CPAP machine. You may have remember me mentioning those in the past. We put her on one of those pretty much at the beginning. She was starting to have breakout issues just because of the mask, and she's allergic to a lot of things. So, well, some things. Her skin just has issues with things. So she hasn't been wearing that, but the nasal strips have been helping her, and that's been really neat to see as far as airway at night. I did encourage her to, and this is part of the myo, big thing is wearing mouth tape at night. And I've talked about that in previous videos, but the goal is just so that she's not breathing through her mouth at night. I don't know if she is or not. I don't see her while she's sleeping, but it just makes sure that with the nasal strip and the nose tape on, or the mouth tape on, that the air is coming through the nose, but there's sufficient airway coming in. So that's been a big deal. One thing that has been very encouraging to me that I have seen, I did recheck her this past weekend as we were doing another myo session. One of the things that the ENT did notice, and a lot of people have commented, is her space in her mouth for her tongue. And that's one of the biggest things. When I look in patients' mouths and their tongues look too big for their mouths, it's not necessarily that they have a huge tongue. It can be that they just have a small mouth. And you can pretty much right away just know they're going to have airway issues when they're sleeping, because there's not enough room in the mouth, so it falls back in the airway while they're laying down. And she had a notable large tongue for the size of her mouth. And because of that, it seemed like, or at least I know one of the doctors who does tongue tie releases, he says she's not a candidate right now because of that. I did learn in my myofunctional therapy training that you can't say right away what their tongue size will be or the tongue space area, because actually myofunctional therapy, they said, can reduce the size. So I was hopeful for that with her. And once they get to a certain level, then they can do the release because there's enough room for the tongue. The reason why they came out with that was because there were 2 cases where people had their tongue ties released and they weren't pleased with the results because it either made their snoring worse and their sleep apnea worse. That was one patient, one case. The other one was they were biting their tongue more. With Kait, she doesn't have any sleep apnea as far as when we had her tested at home and in the lab, so I wasn't too concerned about that, but I do want to do things right. But when I tested her or checked her out this past Saturday, or Monday actually, I saw that she has reduced a size. So she was a Friedman 4, according to the ENT. He said she's a Friedman 4, which means when she opens her mouth and looks back, or when I do, you can't see any of the uvula, hardly anything. It's just totally blocked by the size of the tongue. And when I looked at her this time, you could start seeing her uvula. So there has been a decrease. And that was after 4 weeks and 2 sessions of my own. We're now into our 3rd. So I was extremely encouraged. She was encouraged, which means we're on the right track to actually get her tongue tie released. And the more I learn, the more I think about it, I feel like that's a huge part for her, because she's had issues since she was born, just nursing and all that, choking every time she'd nurse, having colic. All those things were just signs that she wasn't able to latch well and was getting a lot of air in. Having the forward posture, that can be a sign because this is tight, it's pulling it down. Slumped shoulders, having to have 2 rounds of braces because her mouth was small. All these things can be signs, and I mean, she has the tight fascia under her tongue and actually pretty tight on her lip as well. So I spoke with the provider that I've been working with on tongue tie releases. There's a few, but the one that I am going to be working with, and she said we could start going ahead and planning to do the tongue tie release. So I'm very excited about that. We're going to schedule that, and hopefully in November, and see how that goes. I'm not saying she'll see an immediate difference. Some people do. They say about 20% of patients, when they have them released when they're really tight, they just feel a difference right away. And like they can take a deep breath for the first time, or they can actually, their shoulders can go back and all those things. I don't know what will happen with Kait, but we'll see. But it does take some time for the headaches to go away, just time more of the myo and getting the tongue functioning the way it's supposed to, and everything else not functioning in place of the tongue as it's done for so long. Another thing that the doctor recommended that we do is we're going to make her, it's called a quick splint, where it just deprograms these muscles that have been working and firing for so long and causing tension and all that. Then that will help too. And I will plan probably for her to have some kind of chiropractor or osteopathic manipulation to help, because when you've been forward for so long with slumped shoulders and you have this fascia released, you'll tend to still do that to have that posture. And so everything just kind of needs to be stretched and worked out and straightened. And so that's something she'll probably have to have done, along with that. So I will keep you posted. I'm very excited and hopeful for her, and we'll see how it goes. Stay tuned.